Professor Carol Hodgson is the Deputy Director of Intensive Care Research Centre at Monash University. She's going to be leading the study and she joins me now. Professor Hodgson, welcome.
Thanks, Patricia.
Why has the group been set up? Who's partaking and what are you trying to do here?
Yeah, it's a great collaboration, actually. We've got 37 hospitals across Australia. We include all states, and we are collecting data on the survivors of our critically ill COVID-19 patients. So we're interested in looking at the 3 and the 6-month outcomes of our survivors in terms of disability, physical function, cognitive and psychological function, and return to work.
So they're the issues you're going to be looking at. How is the research being conducted? Explain to me the process you're going through.
Yeah, terrific. So we're leveraging off another study which is being run out of Monash University called the Sprint-SARI study. It's already collecting data on all of the patients with COVID-19 admitted to intensive care across Australia. It's a much larger study being led by a colleague and a friend, Professor Andrew Udy and Dr Aidan Burrell. We're then taking the survivors of that cohort and following them up by telephone. We're going to call them at 3 and 6 months from our method centre at Monash University, where we have trained outcome assessors who will call them by phone, so it's telehealth. And we will conduct interviews asking them about some specific COVID-19 symptoms. But importantly, we're going to use some interviews including health-related quality of life, disability measures like the World Health Organisation's Disability Assessment Schedule, the Hospital Anxiety Depression Scale, and some cognitive functioning tests as well. And we'll be able to compare them to other survivors of intensive care who've had acute respiratory failure for non-COVID reasons. So at the end of this study, we'll be able to really say whether the symptoms that we're seeing in COVID-19 are any different to our usual critical care survivors.
So what are some of the challenges involved in researching the long-term effects of coronavirus when we're still trying to understand the virus? It feels to me like all the time we're learning things about this virus and often there's contradictory reports because a lot of this research is so new.
That's right. So there's a couple of things. For starters, there's a lot of people interested in this area. So we're pretty careful that we're trying not to overwhelm the survivors with multiple phone calls from different groups of people all trying to do the same work. So there's a fabulous collaboration across Australia where anybody who's involved in this sort of follow-up work is really trying very hard to work together. So, for example, I'm collaborating with a big international consortium called the Critical Care Consortium. They actually have 362 hospitals across 52 countries, and Australia is just one of them, but it's being led from the University of Queensland. We're just making sure that, for example, if we're doing a health-related quality of life survey, that it's the same one that they're doing, and we'll be able to share the data. So that's one of the challenges, is just not overburdening the patients. And of course, the second one is that, these are patients who have probably had a pretty isolating time in hospital. They may have some degree of post-traumatic stress, and that means they don't always want to be contacted, particularly when they know it's something to do with the hospital stay. So we understand that not all of our patients will want to be followed up by this study.
What are we learning about the long-term effects of coronavirus? It is such a new area of study, but we are learning some alarming things about how this virus affects people who survive it in the longer term.
Yeah, so I guess it's important to say that most people who get coronavirus aren't even admitted to hospital. The symptoms are very mild and there's very little dysfunction of any sort in those patients. And of the patients who are hospitalised, only a very small % of those end up in intensive care. And I'm really focusing on these very severe critically ill patients who do end up in intensive care and on invasive life support. So I guess when you're talking about that cohort, we already know from for example, there's been a meta-analysis of other coronaviruses, SARS and MERS, that showed that they had 40% post-traumatic stress at 3 and 6 months, and that they had about 30% anxiety and depression after the disease process. So we know that there's a risk for these things happening, and we're certainly looking to other international data. So the first cohort studies from Italy and China are now emerging, and we can see that patients have ongoing fatigue, dyspnea, joint pain, things like that. So I think we're learning really rapidly. What we know is that at the moment it's a big black box. We're filling it with data as quickly as we can, and what we hope is that will really improve the outcomes of our survivors.
Just want to reflect, if we can, on today's numbers that have come out of Victoria, of course, it being the place where we're seeing the biggest spike in numbers. Are you taking comfort in the latest case numbers in Victoria, or is it too early to tell?
Look, I absolutely am. I'm sitting in quarantine in Victoria today. Is a research day for me. I'm sitting at home. I think all Victorians are really doing their best to make sure that we do stay at home. Tomorrow I'll be in the intensive care unit, and the message from the healthcare workers in intensive care are very much, please stay at home. We don't want the numbers to increase. At the moment, you know, we're doing really well with being able to care for our patients. In fact, we've got one of the highest survival rates of COVID-19 in the world, and we want to keep it that way. And the way that we keep it that way is not to overwhelm the health system.
Let's talk about your role as a healthcare worker, because we've seen rising infection rates of people on the front line. How big an issue is that where you're working, or for you personally? It must be something that you think about all the time.
It is. It's something, you know, you go to sleep at night thinking about it, and you wake up in the morning thinking about it. This morning I woke up thinking, right, be back in ICU tomorrow. Yeah, it is. I've worked in intensive care for more years than I want to say out loud now, over 25 years.
Really? You look like a spring chicken.
This has been definitely one of the most challenging years of my work life. And I think that I'm really comforted just that we've got an amazing team. The intensive care unit is, particularly where I work at the Alfred Hospital, it's a fabulous team, very close-knit. Everybody looks after each other. We've got fabulous processes. The communication from the leadership team is brilliant. We feel very looked after when we're at work, and we're definitely doing our best to look after each other. But we do want to keep the numbers down. At the moment, we're doing pretty well. We're not overwhelmed. The healthcare sector is definitely coping with the pandemic, but we certainly don't want to see that change.
So what's your message to people who are kind of finding it tiring to stay at home? You know, you're pretty honest with us that you wake up thinking about it, you go to bed thinking about it. You're obviously scared by it. What's your message to people?
I think my message is that if you end up in intensive care and you need life support, you won't be allowed to have your family with you. You won't have any visitors welcome. It means that you're completely isolated, and we know that the COVID-19 patients in particular are staying in ICU longer than our usual patients. So, you know, it's a pretty distressing situation to be in, and I think that I've seen lots of tweets, but my favourite one is you'd prefer a face mask to a ventilator.
Yeah, I think that's right. Thank you so much for joining us, and thank you for the work that you're doing too.
My pleasure.